welcome you to the 2015 CFC Procedure Manual webinar. This is our second webinar focused on the topic of insurance. In preparing for the rollout of this procedure manual, the CFC manager specifically requested some focused information and review on the insurance pieces of the process. So some of what you're going to hear today is going to be a review, and some of it is going to be highlighting the new pieces that have changed or been revised related to insurance. Just in the way of introductions, I think you both know these ladies. We have Chelsea Guillen today, as well as Ann Freiberg, who are going to be presenting the material and responding to questions. Again, on the phone, as we have on the past webinars, we also have some personnel from the Early Intervention Monitoring Program, from the training program, which is in addition to me and Chelsea, and then also from the Central Billing Office with us today to be listening in and hearing the types of questions that are asked, and also in an effort to really promote consistency among the partners. So welcome to our presenters. In terms of moderators today, we're tricking you. It has been myself, Susan Connor, as well as Alyssa Jones from our Champaign office, but Alyssa is actually out today, and so I have Christine Spence with us today kind of helping out in the background with all the technology and kind of monitoring the chats. So we will be your moderators. You guys are pretty well versed in the chat box, but I'd just like to remind people that you can use this chat box for your questions. If you're having some sort of technology problems, if the audio isn't right, please let us know through the chat box, because we can then try to work on that on the back end. The other thing that I will let you know is that you can resize that chat box. So you can actually detach it from the panel and move it around if you want to look at it in a bigger format. So feel free to do that, whatever works for you and your viewing. So today, we have people from all over the state. It looks like we have about 54 connections, but I know and I understand that that represents many more people because some of you are participating in a group setting. So that's wonderful. Thanks for being here. Also wanted to just remind you that we will be using our poll function today. We'll start with this poll question just to get us going and make sure everybody knows where to put the answers. But up near your name, there is a little box with an A in it. So if you could kindly respond to the poll, what's your weather like today? You can choose A for sunny, B for partly cloudy, C cloudy, D rainy, or E snowy. And I hope nobody chooses snowy. So once everybody has had a chance to respond to that poll question, just remember to use your button up near your name. And then Christine, I think it's slowing, so you can go ahead and put up the poll responses. So yes, it's kind of cloudy in some parts of the state, but good news is that many people are seeing sun, which I am not seeing in Chicago. So thanks for checking in. We'll use this poll function throughout the day. The last thing I'll say before I turn this over to Chelsea and Ann is, again, I think you guys are pretty familiar with this. We will put up the post-webinar survey. We will put it in the chat box. You should be able to click on it directly from there. If you are participating in a group, your CFC manager will also get a copy of the webinar survey, and they will be emailing it out to you guys so that you can click on it directly from that email. But just a reminder that everybody who would like a certificate for their participation should complete that survey individually. And then all certificates are going to be sent directly to the CFC. So Chelsea, I will hand it over to you to do a little bit of the review of the agenda.
Thank you. Good morning and welcome everybody. Like Susan said, this is kind of part of a 3-series training on the new procedure manual. Today's topic obviously is insurance, and so the plan for our call today is to really review the various options, or what I'm calling categories, for insurance. We're going to go over some of the forms that will need to be used, and then we're hoping to wrap up with a discussion of ongoing support needs and any remaining questions that all of you have after we've covered the content today. I think we're actually going to begin with a little introduction of Anne's, that Anne is going to do, pardon me, to kind of lay the foundation behind why it is we use insurance in Illinois' early intervention system.
All right, thank you, Chelsea. Can everyone hear me okay?
I certainly can, and I'm assuming they can too. I'll monitor the chat box and let you know otherwise, though.
I'm trying a new plan here with this headset, so I'm hoping it's better than Tuesday. But good morning, everyone, and welcome. Thank you for joining us, as Chelsea said, on the second webinar series for the new CFC procedure manual. The subject of insurance sometimes can be daunting, to say the least, but I do feel that it is important to share with every one of you the valuable aspect, the extra effort of explaining insurance to a family can bring. As personal consumers of our own private insurance, we must maximize our understanding and confidence in the decisions of our medical professionals we seek treatment from. Our early intervention families are no different. We are the front line of defense, so to speak, for helping families make informed decisions on their child's services. In today's economy, cost of any service always plays a part. By sharing financial information of insurance use and family fees with families, and taking just a few moments to look through it with them, ask them if they have questions, and provide any additional resources, we can help that family with encouragement, and we can empower them to make good decisions, not just today about their insurance use, but about any service for their child in the future as well. Many families pay for their private insurance and or have plans that require co-pays and deductibles. Early intervention has a family participation fee. There's so many financial decisions that have to be made, but the focus for the family is usually on the information they just received that their child needs help. And the only thing that family wants to know right now is how to help the child. Early intervention is here as a safeguard to keeping the cost of services to a manageable amount. When a family enters our program, we must take the time to provide them with all the appropriate information about our system's financial benefits. Ultimately, the decision is the family's, but we are here to provide the information so they can make the best decision for their family. Early intervention saves approximately $10+ million annually by utilizing private insurance. When looking at the statistics of how many families have insurance on your CFC's monthly statistical report, it becomes very obvious that using private insurance definitely allows us to serve more children. Helping a family navigate through the process takes some work, but can be beneficial to both the family and the program. Our task is to make this process as informative as we can for a family. The purpose of this particular webinar is to explain the necessary components that must be followed to ensure the family makes the best decision for them. The early intervention provider can also be properly compensated if everything works well, and we can sustain a system for serving children with developmental delays and disabilities in Illinois. We encourage your participation by asking questions in the chat room or any policy or procedure that you feel is not clear, or if you have any recommendations to make it clearer. Or if you don't want to use the chat room, you may also feel free to send those to me later. Thank you very much again for being here. This is a very informative session, and I know it's not the best subject we all like to talk about, but it's a good one for families to understand, and we feel if you can understand it, they can understand it too. So, Chelsea?
Thanks, Anne. So we're actually going to begin by talking about something that all families should receive, and this is the Notice of System and Payment Fees as well as the Family Participation Fees Program Fact Sheet. These are two critical pieces of information for helping families understand what the expectations are around their participation in the early intervention system. This is just a reminder that you can probably save yourself a fair amount of time and perhaps a few future headaches if you really take the time to review this information thoroughly with the family on the front end during intake. It's also a reminder that it should be reviewed again at each annual IFSP as family circumstances may change during their time in our system. If a family has no insurance, that's the first category that we're going to talk about. We want to make sure that we use the screening device for determining family fees and eligibility for all kids in DSCC. This is to help us figure out if a family could be potentially eligible for public benefits. This is a change to the manual, the second bullet here, because families with the change in regulations can no longer be required, but should still be encouraged to apply for public benefits if they do not have insurance. Another reminder here is that if a family indicates that they are going to or perhaps have recently applied for all kids, make sure that you check in with them occasionally about the status of that application. And then another reminder that you want to keep families aware of the fact that they should report any changes in their income or family status. It may also be a good idea to check in with them periodically during your monthly contacts to see if anything has changed. And though we list that here on this slide for families that have no insurance, it's probably an important reminder that the screening device is going to need to be completed with other families as well, because you're going to need to know about their cost participation in the system, otherwise known as their family fees. The next category we're going to talk about are families who have public benefits only. And so if that's the category that the family falls in, we want to make sure that you obtain a copy of the All Kids card or print the PA-42. And so in prepping for this, Anne reported that the PA-42 has had some reported problems recently. And so we're asking you to check to see if the screen matches the card. If for some reason there's a problem with the screen, then she wants everyone to know that possession of the card definitely takes precedent. In the manual, we also list the MCOs. And so we've just put those here on the slide because this was a change to Medicaid coverage a few years ago. And so you may see names like this actually on the family's All Kids card. So if a family has public benefits only, then you want to ensure that the family has been provided the consent to use PII and to bill public benefits. You also should know that in the case that a family has public benefits only, no BV is needed, and you want to make sure that the authorizations reflect no private insurance. Well, that slide looks different than it did last time. So hopefully that's all right for you. We've got the form up here, but when families have public and private insurance, you want to make sure that the family signs both sets of consents. The first one is related to private insurance, and that's the one around consenting to use their health care plan benefits and assignment of rights, and then the form we referenced earlier, which is the consent to use PII and bill public benefits. And when the family has both public and private insurance, they will need to go through the benefits verification process. And so you're going to submit the normal BV as outlined in section 10.4 and discussed here momentarily when we review private insurance more in depth. So families whose children are enrolled under private insurance plans that are not employer self-funded now must allow use of their benefits to assist in meeting the cost of EI services and assistive technology devices, as Ian described earlier. And so for families who have the non-employer self-funded plans, what we're asking you to do is after 11/1/15, the next annual that they have, make sure that you review this change with the family and have them complete the appropriate form. And I guess I should mention, starting November 1st, 15, if they're in a non-employer self-funded plan, you will no longer need to obtain the consent aspect of things in order to provide access to insurance. However, families whose children are enrolled in employer self-funded plans must continue to provide informed consent prior to using their insurance to assist in the cost of services. And so you can see, once again, this is a form that was included in the packet that was sent out prior to the webinars. It pretty clearly outlines, I don't know if you can see it under the yellow, but there are different sections for employer self-funded, and then down at the bottom, the non-employer self-funded plans. So this is just to kind of summarize that process, because this is a change. The benefits verification process will actually occur earlier now. In fact, it's going to be completed prior to you even needing to obtain any kind of consent, because you're actually going to be completing this process to even know what kind of plan the family actually has. Once you submit that information to the central billing office, that process will tell you whether the plan is self-funded or not. If it is an employer self-funded plan, then the family needs to complete both the consent portion as well as the assignment of rights portion of the form that I just showed you. However, if it is not an employer self-funded plan, families are only going to complete the assignment of rights section. Okay, so here's another poll question. So helping families understand the implications of using their private insurance is not a role of the service coordinator. True or false? Pick A if it's true, B if it's false, and once again use the letter up by your name in the participant field. Okay, thanks, Christine. So it looks like, right, we've got the right answer here. Hopefully Anne's introduction helped you understand the importance of explaining insurance use thoroughly to families and the benefits to the system as well as to families from participating in that process. So we're going to walk through some other pieces of this here around private insurance. And so I think a key point here, and I think that came through in Anne's introduction, is really making sure that families are fully informed of the benefits and consequences of waivers, exemptions, and family fees. Each situation will obviously be different, but families really need to understand how the use of insurance may impact their financial contribution to the system. And so one factor for families' fees, obviously, is how much the system pays out on their behalf. The Notice of Systems of Payments and Fees can be a really useful document in helping families understand the various prerequisites. And so we would encourage you to take the time to review that with the family and make sure that you've answered their questions before moving on. These next two reminders are certainly more related to service providers, but since we know that service providers look to you for information and guidance, they're included in the CFC procedure manual as well. And so this is just a reminder and information you can share with providers that they're required to follow authorizations for services. And so that applies to whether or not they should use the insurance, if the family has a waiver, exemptions, so on and so forth, and a reminder that they need to follow those policies and procedures. The next piece here is really just a reminder that there are a few exceptions to insurance billing, and so these provider types would not need to go through that process. And so once again, not something that impacts your daily work, but certainly you're a good source of information for your provider pool, and so they may be asking you questions about that, and so that information is included here in the manual for you. So with the benefits verification process for private insurance, you're going to copy the front and the back of the card. And once again, I think that from the information I've seen on the form, it looks like to the degree that you can enlarge that and make sure it's a good copy, the CBO appreciates that. You're also going to submit a copy of that card with the CFC fax cover sheet and send it to the CBO. And so the addressee and their fax number are already pre-printed on that form. The CBO will then verify the benefits and provide the results to the CFC within 5 working days. And there is more explicit information in the new version of the manual in terms of defining how days work for the CBO. This is another important reminder, especially when you're talking with providers, that the CBO benefit verification process is really kind of a high-level process, and it does not replace the more comprehensive process that a provider should perform with the insurance plan directly. It's probably important to let your providers know that if they don't end up doing their own benefit verification process, that they could risk non-payment for the services that they provide. So because we figured people would have a lot of questions around the private insurance use, because this really is probably the biggest change in this chapter, we just wanted to highlight again the differences between when families have an employer self-funded plan versus not. And so once again, you're going to submit that benefit, the BV, and if the results indicate that it is an employer self-funded plan, you're going to need to immediately contact the family to ensure that you still obtain informed consent for the use of that family's plan. You're also then going to complete the consent to use private insurance or healthcare plan benefits and get their consent to assign rights for that plan. When families consent, make sure that you provide authorizations that indicate private insurance billing is allowed. But with these plans as well, you still need to follow any needed processes for both waivers and exemptions. For families who decline access to their private insurance, you need to make sure that the authorizations reflect that information as well. If it's a non-employer self-funded plan, but still private insurance, then you're going to work with the family to determine the provider choice based on the information you receive from the benefits verification process. You'll still have the family complete the same form, but in the instance when it's a non-employer self-funded plan, the piece that they're going to be completing is really related more to assignment of rights rather than to consent for access to their plan. Okay, so I think we've covered the categories, and so we're going to take this opportunity to review questions. So Susan, do we have some that have come in? Yes, we do have some that have come in. Anne has done a great job responding to the ones directly in the chat, but I thought it was worth reviewing just a few verbally to make sure that people saw them. One of the questions was about the benefits verification for private insurance no longer requiring a copy of the consent to use private insurance. I don't know if Anne or Chelsea, if you want to kind of talk about it. There seems that there's like 2 levels of the of that process, that CFCs can actually submit the benefits verification without the consent, and then the consent can be sent later when you're preparing for IFSP. Is that accurate? Right. So I think Anne was saying she may need to be unmuted, but I'll go ahead and take a stab at it, and then she can correct any misinformation. But right, the benefits verification process can be completed without consent, because just doing the benefits verification doesn't mean we're going to access the plan. It's actually the process that allows us to know what kind of plan the family has. In fact, on the last webinar, we discussed it's very difficult to determine plan, whether it's an employer self-funded plan or not, just based on looking at the card. And so you're going to complete that benefits verification process first to get information about what kind of plan it is, and then knowing what kind of plan it is directs you to what additional pieces of the forms we've referenced need to actually be completed.
And Anne, did you have anything you'd like to ask?
Did a great job, Chelsea. That was it. Correct. The BV process is just to find out the type of plan and the high level. Once you get that back, then you can make the determination for the process of how to choose providers and things like that, and get the appropriate consents and move forward.
Great, thank you. I think the other question that came up was, does the 5-day timeline for the benefits verification process apply to all plans? And Anne answered that yes, it does apply to all plans, but in the revised manual, you will see that it talks about 5 working days, which is Monday through Friday. It does exclude holidays, and one of the important things to note in the revised manual is if the benefits verification information is received by CBO after noon, after 12 p.m., the first working day starts the next day. So just as a clarification, all of that is really clearly laid out in the new manual. The other question here, I'm hoping that everybody saw it, was sort of when are these new policies and procedures going to be in place, and November 1st is the date, and Anne did clarify that a memo is going to be coming from the Bureau with the final manual that will have all of the final forms in it as well. And I think, unless I missed anything, I think those were the only questions.
Okay, thanks.
I think you can move on.
All right, sounds good. We're going to actually restart here with a quick audience poll. And so you think about the following when listening to insurance webinars. A, what should I have for lunch? B, why won't they stop talking? C, when can I go home? D, all of the above. Or E, of course, none of the above, because you're giving us your full attention. Okay, wow. Well, I see some people were unwilling to respond, which I can completely understand, especially if you're sitting in the room with a supervisor. But I'm also heartened to see the number of you that are completely giving us your undivided attention. And I am just going to admit that I missed breakfast, so I am actually thinking about A right now, but I will try to stay on task to the degree that I can. So our next piece here is moving away from the insurance categories and really talking about some of the other pieces that may play into those private insurance categories that we just described. And so we're going to talk a little bit about waivers and exemptions. And so to start, we're going to talk about some general guidelines for waivers. And just a reminder to completely fill out that form. Missing information can result in them just flat out denying their request, or it can delay the process because you're going to need to resubmit the same information. The CBO is going to process the information around waivers within 10 working days. And once again, the working days are clearly outlined in the manual in the way that Susan just described. This is a reminder that you're going to want to maintain all the supporting documentation for the waiver in the child's permanent file. You're also going to assist the family in finding a provider based on the allowances of the plan. And so you're going to use the information that you've learned about the plan to ensure that any rules and restrictions for that plan are followed. If the waiver is issued and later an available in-network provider becomes available, then we're requesting that you work with the family to make the switch. And so we just wanted to clarify this isn't saying that we're expecting that you're calling all the providers on the in-network list over and over again, but it could be important to have this discussion with the family on the front end as you discuss the waiver and letting them know about the benefits of transitioning once an in-network provider does become available. I think this is a really important reminder here that waivers are renewed annually and they are tied to the IFSP year, but it is pretty rare that an IFSP year aligns nicely with the family's benefit year. Many times the benefit year is either based on a calendar year or the company's fiscal year, and so you need to make sure that you keep in touch with the family about any changes that might occur around the benefit year rather than the IFSP year. We're also going to talk about the pre-billing waivers, and so the CBO will inform the service coordinator if there is a need for a pre-billing waiver due to their knowledge of there being no enrolled early intervention providers in that network or the necessity for a PCP referral that cannot be obtained. The CBO will work with you to issue a pre-billing waiver to the service provider. But this is just a reminder that the waivers can actually be issued before the provider is identified. Based on the information that you can receive through the benefits verification process, it is possible to know if a waiver will be obtained for a particular discipline. And so in the case when that happens, the waiver needs to be adjusted when a specific provider, is identified. And so remember that a change in providers requires a new waiver. And so once again, if it's within the same discipline, you get a waiver for one provider, but later you need to change the provider, you will also need to change the waiver. And then I think that last bullet there is another important reminder that providers should not be performing services without that process being completed and a waiver actually in their hand to have for their records as well. Another category of pre-billing waiver comes up when the service coordinator has contacted all the providers on the BB list without finding one who's available to accept that referral within 15 days. In this case, the service coordinator needs to submit the pre-billing waiver request and once again make sure that the family's understanding the benefits and consequences of going outside of their insurance plan to obtain services. And so this is a reminder because I know that there's a heavy emphasis on the service coordinator's role in this process. And so it's not the expectation that you're going to know each and every plan for every child that you serve in detail. But once again, it's really what Ann described at the beginning, that the service coordinator's role is really to inform families so that they can ask good questions, inquire about their health plan, and make the best decision for their particular family. So when you're trying to obtain a pre-billing waiver, you're going to complete the waiver request section of that fax cover sheet and provide the appropriate case documentation. In the instances in which you would be doing that is if a provider is not available, a provider is not enrolled in this family's network, or a family would have to travel either more than 15 miles or 30 minutes to reach a provider. And obviously this is only applicable when center-based services have been recommended by the IFSP team. So we also got some clarification from CBO, hopefully to facilitate the waiver process. And so they helped us identify a few key items that they're going to look for in the documentation that you submit to them with your waiver request. And hopefully this will facilitate more complete and accurate processing. And so they want to make sure that you include the full name of the office or the facility contacted, and they're particularly asking that you include no abbreviations. Include the name of the person that you spoke with, and in this instance, first name is enough. Make sure you include the phone number that you called, including the area code. Also document the result of the conversation, whether they can take the case, and if not, why. Once again, not necessarily a novel, but certainly a summary that makes it clear. And then if more than one provider or facility is actually listed on the BV, the service coordinator is expected to contact all of the listed providers. The other kind, sorry, I did miss an important note there, sorry. If the CBO is aware on the front end that there are no insurance-enrolled EI credentialed providers at the time that they actually complete the benefit verification, they are going to go ahead and issue the pre-billing waiver, and so that will be returned to the service coordinator. The other category of waivers here are the post-billing waivers, and this is if a provider bills private insurance and receives information that either A, the service is not covered, or B, the maximum sessions have already been exhausted and so no additional benefits will be paid. Then the provider is going to submit the claim along with the insurance claim and or notice from the company, and the CBO will issue a post-billing waiver for the remainder of the benefit plan year. So another check for understanding here. Post-billing waivers can be issued before a provider has a claim or a response from the insurance company. Is that A, true, or B, false? Okay, looks like we're slowing. Christine, thank you. Right, of those who responded, right, the majority know that, right, a post-billing waiver can only be provided once a response from the insurance company has been provided. All right, we're going to stop here and see what other questions have come in through the chat box.
Yes, I think we did have a couple questions. Again, Anne has done a really nice job of clarifying in the chat box, but I wonder, Anne, if you would like to clarify on the when a waiver is in place and there is a provider change. It sounds like there's not an easy answer for this because it depends on what reason the waiver was put in place, but if you wanted to clarify verbally so everyone can hear.
Thank you. Yes, I guess the situation can vary, and that's what makes insurance, unfortunately, a little more complicated. But if the waiver was provided to a speech therapist because there's no in-network providers available at the initial start of services, and then later that speech therapist leaves, the CFC would want to find out if there was any changes in the plan or if there are any in-network providers available now that could help save the family some money and avoid extra family fees to pay. So they would probably do the process again and request a new BV and a new waiver to make sure that they're helping the families out as much as they can. I mean, overall, it's probably just best to make sure everything is the same and nothing has changed with regards to the insurance coverage for the family.
Thanks, Anne. And the other question that came in was in the instance where the IFSP is extended and there is a waiver active for one of the providers. It sounds as though the CFCs would need to inform CBO of the extension of the IFSP. Is that correct, Anne?
Exactly. Those waivers do have end dates that the CBO doesn't know you extended the IFSP, and the provider then could potentially risk not being paid during that extension time. So it probably a checklist or something, whatever, it makes it easier for you to remember that if you extend the IFSP, to also send an email over to your insurance processor so they can extend the waivers for the providers.
Great, thank you. And I don't believe we had any other questions come in, so I think you can move on.
Okay, thank you. So the next thing we're going to talk about are exemptions. And so if the family chooses or the service coordinator becomes aware of the need for an exemption, once again this is for private insurance, the service coordinator should submit that request by indicating an exemption request on that CFC fax cover sheet. There are a variety of reasons why an exemption might be requested, and so we've listed 3 of those here. If a family has an individually purchased non-group plan, they can become exempt. If their plan has either lifetime cap, so limits on an EI service, or if the family would exceed or exhaust those limits if that plan is used for EI, that's a reason to get an exemption as well. And it could also be that the family has a tax savings plan that automatically withdraws funds when claims are submitted, and the family agrees they don't want the tax savings account to be accessed by early intervention. And so we're going to talk about, I'll bring it up in a minute here. So in June 2013, Illinois law began providing certain assurances for the non-self-funded plans, and I believe this was in response to the Affordable Care Act. So if the family's plan is not consistent with these assurances, because I think Ann shared on the last call there were a few kinds of plans that were actually grandfathered for a period of time. If you find that a family has one of those plans, you want to contact your EI specialist to begin an investigation, and this may be another reason that a family receives an exemption from use of their private benefits. So this is a piece I was just going to circle back around to. So for the tax savings plan, additional documentation is needed so that the CBO knows how to contact and gather information about the tax savings plan account. Families can actually decline the exemption for this particular category as long as they are well informed of the consequences of their decision. And so once again, in these cases, those funds may be automatically withdrawn, and so the family just needs to understand how that will impact that particular account. So if the family does actually decline the exemption and requests that EI utilize the tax savings account, then you need to have the family sign the acknowledgement that they're declining and then submit that with the fax cover sheet so that the CBO is aware of this. This is the piece where I was also going to add those individually purchased non-group plans. Families can actually also choose to use them. So in other words, decline the exemption. And so there's not currently a form for that, though there may be in the future. And so if a family purchases their plan but decides to use it for early intervention anyway, and once again this could be because it has financial benefits to them to do so, then you would certainly want to document that in your service coordination case notes and probably also document it in the letter that you send to the family and keep in the child's file so that it's clear to all parties what the choices are. So we have a quick check. I'm not sure if anything else came in, maybe related to exemptions or waivers that we haven't covered yet.
Yeah, a few things came in. And again, Ann is answering some in the chat box. I think, Ann, if you want to say just a few things about how long CFCs need to wait for these responses from possible in-network providers that could be available.
Sure. That's a good question. It's been asked before, and the answer kind of has remained the same, and that is however long you currently feel is appropriate now. There is no set policy because we believe that the providers in your area, you know them well enough and know that, hey, if she hasn't called back by, 2 o'clock tomorrow, I know that she probably doesn't have any openings or, whatever. We feel you probably have a better handle on that than we do. So just document when you're, the appropriate time that you choose is over and move on. It's going to vary probably by CFC and potentially by provider. Some providers are very proactive about responding, and others, just, we know we're out in the field doing our work. So whatever you're doing now, I'm sure it's working. Just keep it up.
Yes, and I think just circling back to what was brought up before, the documentation piece of it is the really important part to ensure that the appropriate documentation is there. The other question that came up seems like, I'm not sure if we need a clarification on this, but it sounds like some CFCs have been informed that they no longer need to notify CBO when an IFSP is extended in the case of a waiver. But Anne, I think you had said that it is something that needs to happen because CBO is not able to see that. Was it something you just need to check on?
I would. I'm checking with CBO, and I don't know how they would. They do get a file from Cornerstone. There's no. That's a true statement, but there's no systematic way that like pops up an email that says, "Hey, a CFC just extended an IFSP." So we're not sure how this is happening because we don't believe it is. But we can work a little further on that, and I appreciate the question, but I just, at this point, I'm working with CBO, and we're saying that we don't know how they automatically would know, and that it would be the CFC's responsibility to inform their processor that they need a waiver extension based on the IFSP extension. But we'll get back to people on that with the FAQ at the end. And I also wanted to clarify, it was brought to my attention, and I thank the people who are responding back, the 5-day benefit verification response time. I do recall we had, now that it's being reminded to me, that a while back we had some issues where the HMOs sometimes have to have a PCP referral. Not 100%, but probably will have to have a PCP referral. And if there is an issue with getting that PCP referral, it may take a few more days sometimes to coordinate that BV response back to the CFC. So I think in the past what DHS has allowed is for the CBO to have up to an extra 5 days, if necessary, if we do have to work with getting a PCP referral that doesn't seem to be forthcoming up front. So, but otherwise the 5-day process is the norm.
Thanks, Anne, for that clarification. There is a question people are wondering, in the event that an extended IFSP does happen and there's a waiver associated with one of the providers, if the waiver extension is not submitted to CBO in a timely manner, is there a process for submitting a heat ticket for that?
Well, that's a good question. I'll check the data correction manual again. I apologize, I don't have it in front of me. But I want to say no, only because there are end dates on those waivers. So the provider should be aware that, if they had a waiver that went from January 1st to December 31st, and then the team decided to wait until the following January to have the meeting, and the IFSP was extended by 2 weeks or 3 weeks, that they would have to also help remind the service coordinator to say, hey, don't forget, I need corrected waivers, so the CFC can then contact their insurance processor and get that done very quickly.
Thanks, Anne. The last question that came in is really about the family fee portion of it. There's a request for clarification on how families can pay for their family fee. Is it only by check or money order, or are there other ways?
At this time, to pay your family fees is only a check or money order process. We have been asked and have started the process now that we have a new lockbox vendor to look into electronic submissions. It's something we definitely want to get into. Our new accountant is being trained on family fees shortly, and hopefully we can tackle that task at the same time and help bring ourselves up in the world of technology just a little bit.
Thanks, Anne. And I think those are all of the questions for right now, so we could probably move on.
Okay, thank you both. So now we're going to talk a little bit about insurance changes, and once again, this is not talking about what we covered before in terms of provider changes, but if the family's actual plan changes. And so when the status of private insurance changes, either to a new plan or they obtain private insurance, or I guess in this case discontinue as well, the CFC needs to act swiftly to ensure continuance of services and to make sure that their providers continue to get reimbursed by doing the following. You want to check monthly to ensure that all coverage is the same. And once again, this is going to be that reminder about major plan year changes. And so once again, the waivers, exemptions, everything is tied to the IFSP year, which once again is not likely to coincide with the benefit year. And so particularly around periods of time like the end of the calendar year or the company's fiscal year, that may be when plan changes occur. And so it is not unusual that the provider might discover that update first when they try to bill and find out the family is no longer covered by that particular plan. And so if it's a provider that lets you know that, you want to make sure that you're taking appropriate actions as soon as you can once you learn of the change. For these changes, you're still going to use that CFC fax cover sheet, and in this instance, you're going to complete the change and update section on an active child with an IFSP. And so once again, these are changes that occurred during the IFSP year. For families that are either obtaining insurance for the first time or families who are changing private plans, they'll both receive a 45-day exception to insurance billing, beginning the day the CBO receives the request from the CFC. And this is just a reminder that this 45-day exception allows the services to continue and the provider to bill the CBO directly for a period of time while that benefit verification is processed and determinations about benefit coverage is obtained. As soon as the results of the BV are received by the CFC or the 45 days end, the services are expected to be delivered in the manner that matches the BV results. And this includes if you find there's a need for a waiver or an exemption. If the family doesn't have a new card yet, the CFC can still complete some information using the CFC Change of Insurance Notification form and the CFC fax cover sheet to help begin the CBO process, the benefits verification request. Families who are changing from having private benefits to having no private benefits will have their services billed to EI. And this is just a reminder that this will likely impact the family's fee as insurance will no longer be contributing to this process. In these instances, you're still going to submit the updated request to the CBO, and you're going to adjust Cornerstone only when you receive confirmation of the lapse state in private benefits coverage. After you receive that confirmation, you need to go in and adjust authorizations to indicate no private insurance and make sure that you send new authorizations out to all direct service providers, correctly reflecting the current insurance status. For families that are losing their private benefits coverage, it may be important for you to know about other options for obtaining private benefits. And so you might help a family or remind them about checking into All Kids coverage or options that are available under the Affordable Care Act. And they can access that information at getcovered.illinois.gov. Okay, we're just going to go over the fax cover sheet because we've certainly referenced that a fair amount here, and just make sure we're clear on which sections need to be covered and when. So the top part of it, obviously, Section 1 gets completed for everyone, and we encourage you to complete that accurately and completely so that you don't have your sheet returned to you. Section 2 identifies which services are being verified, and once again this is where you can see what kinds of attachments you might need, and remember we talked about desired documentation on an earlier slide. Section 3 is the one that we were just talking about, and that's really if there's a change to the family's current insurance information within the IFSP year. Section 4 is the part that you would complete if you're looking for a waiver or exemption request. And once again, it's quite detailed in terms of which kind of waiver or exemption you're requesting, and then also outlines nicely the documentation and attachments that are necessary to be submitted based on the kind of waiver or exemption you're requesting. So that brings us to the end of our content. I don't know, Susan, do we still have some lingering questions or other things people want to go over before
currently
we end?
There's not any new questions in the chat box, but we can kind of leave it open for another minute or so in case there's a straggler. I think one of the things, as Chelsea said, that, you know, and Ann said at the beginning, we really want to encourage people to kind of keep the communication open. We recognize that as you begin to implement some of these revised policies that more questions may come up. So, you know, Ann has certainly said email them to her. You can email them to Chelsea or the training program, and we will certainly pass them on and work to get answers to those. I don't think we have any other questions, but I think as a way to wrap up, Ann would like to make just a few comments in closing before we share the end of webinar survey. So Ann, you should be able to speak.
Thank you, thank you. I also wanted to say that per the request of the CFCs, we are preparing a kind of a talking tips sheet regarding the financial influences of insurance use, family fees, and things like that, that should help the service coordinators when meeting with families, when they're discussing these subject matters, to kind of help families make that decision. We've created a similar one for the process of helping a family make the decision of doing IFSP with evaluation and assessments the same day. We're going to do a similar one now for the use of insurance and how it affects the family, how it could potentially, I should say, affect the family based on their plan, to help, once again, empower the family to get all the knowledge they can about their coverage, but also help the service coordinator understand where the family might be coming from, and so we hopefully make that best decision that the family can possibly make. So that will be forthcoming as well.
Great, thanks. Chelsea, anything in closing?
Yeah, I was just going to say, so we do have a couple of things that we've already taken notes from the other webinars and even presenting that information to the CFC, and so those are the things that Ann was talking about. I would encourage people as they think of things or if they have additional questions to let us know, because we're hoping to develop a FAQ document at the conclusion of all the webinars, because we don't want to leave people hanging. But if people think of other kinds of support needs or documents like Ian was referencing that could be helpful to have to support their work with families, please don't hesitate to let us know, either the chat box now or when you complete the survey, or in a follow-up email later.
Chelsea and Ann, there were two questions that came in right at the end, and the one is about IFSPs that currently that families have already declined insurance use. How do they handle that?
Yeah, so that's what I was trying to make clear earlier, and maybe I was stumbling over my words at that time. And so I think what Ann had shared on the last webinar is that starting November 1st is when we have this delineation between consent and assignment of rights, depending on whether or not it's an employer self-funded plan. And so for those who are currently in the situation where they've declined insurance insurance use, but in the future consent isn't necessary, we would expect service coordinators to make those changes at the child's next annual. The other changes go into effect as of November 1st. So for all new families that enter as of November 1st, those will be the families that are entering under that distinction between the employer self-funded and non-employer self-funded plans. Anne?
Thank you, Chelsea. Yes,
yeah.
Exactly. When November 1st hits, that's when the new process for new families entering would have to take place. That the BV would have to help the service coordinator understand if the family does have a self-funded plan or not. And if they do have a self-funded plan, we would still have to get their consent. And there are a lot of those, unfortunately, but self-funded are a lot of your major hospitals, major corporations. They just want to assume the risk of the cost of medical care for their employees rather than pay an insurance plan to do so. And by doing that, those assurances we entered into statute do not protect them. So just watch the manual. I think it outlines it pretty well. Also, another thing we'll be providing to the CFCs is kind of a high-level memo from the Bureau that explains the changes, for this, so that when you have that annual with that family next year, that or next few months, whatever, that currently has declined, but based on the type of insurance they have, they won't be able to automatically, they can't do that any longer, that you could share that information with the family to explain why this change is necessary at the annual. We chose not to make the CFCs go out and chase down the families who had declines to check and make sure that they could still do so or not. It just was too much work for everybody. We didn't think that was wise use of the time for the service coordinators. So we'll also provide that letter for the annual when that comes up over the next year, that you can help the family make that choice as well to understand why we're doing this.
Perfect. Well, I think that wraps up our questions. I did want to just remind you guys and also give you guys the link directly. So again, if you are on a computer and you're participating independently, you can go ahead and click right on that link for the survey and fill out the survey right away. That way, I know everybody's busy and it kind of gets away from you as the week moves on. We are asking those to be completed by Sunday night. But again, if you can click on it right now, you can go ahead and complete it. It's a very short survey. We will be then using this to prepare the certificates for everyone, along with the list of those who participated from the CFC managers. So again, the CFC managers will receive an email that has the link in it as well. So if you'd just like to send that out to your staff, that would be great. I think other than that, if people have any questions related to that, you can feel free to email me directly. And I just want to thank Chelsea and Anne for presenting and facilitating and answering the questions. I think it helped to clarify a lot of the information around insurance. So thanks, everybody. Have a great rest of your day and rest of your week.
Thank you. Bye.